Hello, and welcome to this week's Medical Minute. Today we'll be talking about Crohn's disease. Crohn's disease is a condition that falls under the category of inflammatory bowel disease and results in chronic inflammation and ulceration of the gastrointestinal tract. It's important to know that inflammatory bowel disease is not the same as inflammatory bowel syndrome. While the two share similar symptoms, IBS is a functional disorder. The GI tract looks normal, but doesn't function as it should. As is seen in most chronic illnesses, patients with Crohn's disease experience episodic flare-ups as well as periods of remission of the symptoms. The CDC reports a prevalence of 26 to 199 cases per 100,000 persons in the US. The incidence rate is between 3.1 to 14.6 cases per 100,000 persons each year. Crohn's disease is often diagnosed before the age of 30. It's more prevalent in women, smokers, and those of Caucasian and Ashkenazi Jewish origin. The inflammation and ulceration seen with Crohn's disease is a result of the immune system attacking sections of the digestive tract, but the specific etiology is not well understood. It's believed to be an environmental response to something in the GI tract, not a response to the body's own cells, so many refrain from classifying the disease as an autoimmune disease. The area of the GI tract most commonly affected is where the end of the small intestine, the ileum, meets the beginning of the large intestine, the cecum. With that said, it should be noted that Crohn's can affect any part of the GI tract from the mouth to the rectum. Common symptoms of Crohn's disease include frequent diarrhea, rectal bleeding, unexpected urgent bowel movements, abdominal pain and cramping, constipation, and a sense of incomplete bowel movements. Other general symptoms include fever, a loss of appetite, weight loss, and fatigue. In severe cases, Crohn's disease can cause anal fissures as well as fistulas, or a tunnel of tissues that connects different organs requiring urgent medical intervention. Individuals who suspect that they have Crohn's disease are advised to meet with a primary care provider, who may refer them to a gastroenterologist. When confirming Crohn's disease, a healthcare provider may test the blood for anemia or infection, and they will also likely test the stool for blood. A colonoscopy and a CT of the abdomen and pelvis are also frequently performed. The colonoscopy is used to visualize the entire colon and the end of the ileum. A sample of the inflamed cells obtained from a biopsy during this procedure is one of the most helpful confirmations of the disease. The treatment of Crohn's disease involves a combination of anti-inflammatory drugs, immune system suppressors, antidiarrheals, and nutritional therapy. With any chronic illness, seeking additional information, joining a support group, and talking to a therapist are recommended. I hope you learned something new with this week's Medical Minute on Crohn's disease. As always, thanks for joining me this week. I'll see you next Monday for a review of aspirin. And for more updates like these, come join us online.